Chapter 59, Antiemetics. As you're looking at medicines that prevent nausea and vomiting, you can review the slides of the PowerPoint from Chapter 59. You have slide 2, 3, and then 4 gives you the actions of sites. Now what I'll be reviewing for you are the prototypes and the mechanisms of action that you need to really pay attention to for your studies. As you're looking at centrally acting antiemetics, there are different classifications that are listed on slide 5. And so one of the things that you need to be especially attentive to is that these drugs, even though they are antiemetics and anti-nausea drugs, they still have CNS principles. So keep in mind the underlying theme of all of pharmacology is whenever you have a drug that affects the CNS, we're worried about patient safety and, again, patient safety. So you're watching them for dizziness, postural hypotension, as well as keeping them safe, keeping the bed rails up, and placing them in places where they are safe. And so as we go forward, the first prototype is, for the phenothiazines is the propyrazine, which as a brand name is Compazine. Now, Compazine controls severe nausea and vomiting, and so we use this quite a bit in the ER as well as the ICU. And you notice that the mechanism of action is listed there as unknown. Oral, rectal, IM, IV are ways that we can use Compazine. And so look at Compazine, the fact that it does set in fairly quickly, and it peaks fairly quickly as well. As you go forward, you're going to see the non-phenothiazines. And the main drug there is metoclopramide. What I need to point out here is that it has an action listed that truly is actually different from what it does. There's an item of disparity from the book and from what other citations state. Metoclopramide, which is Reglan, it actually prevents nausea and vomiting, as well as it's what's called a prokinetic, and it helps things move through the gastrointestinal tract quickly. Here on this slide, on slide number 9, it says it slows gastrointestinal activity. Actually, it speeds it up. And so we talked about that already, so I'm not too worried that you're going to be caught off guard by metoclopramide being a prokinetic. But keep in mind, too, here there's the drowsiness, fatigue, restlessness, and the EPS, the extrapyramidal symptoms that are associated with it. Your next section, the anticholinergics, you'll go forward, and again, you note that anticholinergics, antihistamines, there's their drowsiness, confusion, dry mouth, and meclizine is there. Meclizine you might recognize as a anti-nausea drug for travel nausea, travel-associated nausea. Remember, there's the other drug with that called scopolamine that probably is used even more than meclizine, but meclizine is used for motion sickness. And it sets in fairly quickly as well. Dry mouth, of course, as any anticholinergic, there's dry mouth as a side effect. Going forward, there's the serotonin receptor blockers. And the prototype there is ondansetron, which for brand names we think of Zofran. And Zofran is, ondansetron is really classic for treating the nausea and vomiting that's associated with chemotherapeutic drugs. And so that's right there on slide 14. And you look and see that the IV is immediate onset. Oral is 30 to 60 minutes. One of the things you're going to find in practice is that this drug is stored in the refrigerator, and you'll need to draw it up if you're giving it IV push. And so ondansetron is really classic for your chemotherapeutic associated nauseas. But we also use ondansetron we'll use as well in the women's health arena when you have a laboring woman. Going forward, slide 17, they have the neurokinin receptor antagonist, and they have listed aprepitant. That's not as important as your ondansetron and metoclopramide, so focus your studies more on those. Look across the lifespan as to when we're utilizing these drugs. And children, of course, they have the propyrazine, which is the Compazine that you use most with children. But then as you get to adults, we're treating more the antiemetics associated with surgery, chemotherapy, with motion sickness, and with laboring women. Older adults, of course, have adverse effects more often because of their lack of body mass. And so we need to really keep in mind that, as well as the hepatic involvement of our seniors as well. And so chapter 59, we've already covered these drugs in other areas, so I just wanted to record this video just to make sure we solidify the antiemetic use of these drugs, because we've talked about them as prokinetics, we've talked about them as adjuvant with chemotherapeutic drugs, and so this chapter is really just there to solidify what we've already learned. So focus your studies on those, and I'll look forward to seeing you soon.